Everybody blow your trumpet. That is Minister Lombard Machinge. Blow your trumpet, as according to Joel 2 verses 15, reminding me of the Jericho walls when the children of God or the Israelites had to shout, give a shout at the end of going around the Jericho walls for 7 days, quiet, and just the worshippers at the forefront, the priests at the forefront. And so, yeah, at the end, they had to give out a shout. And it says, blow your trumpet in Zion. And before that, gave you Apostle Jethro Malinzisa, Love Somebody. 6 minutes it is, just after 10. You are on Just For You with me, Spongile Mofokeng, with you up until 11 o'clock. And Dr. Tlailane is in the house. Ooh, see, you make me sing today. You make me sing.
Yes,
How are you, Dr. Tlailane?
I'm fine.
Uh-huh.
I'm very good.
Welcoming you. Been a while. Are you okay?
No, I just wanted to adjust this mic.
Okay.
Yeah.
Turn
But I
it
don't
towards
know-
yourself.
I don't know if it's really, yeah, okay, fine.
Uh-huh,
Am I
there.
coming out loud and clear?
Oh, loud
Oh,
and clear,
thanks,
loud
thanks,
and
thanks.
clear. Thank you so much for coming through and being with us today. And I know you're very cold that side. We are sitting on 18.5 degrees Celsius in studio, you and I.
Yeah, but it's too low. You know?
Thank you, Annie, for the tea.
Thank you very much.
God
Yeah,
bless.
I'll hold myself.
Yeah. See, Radio Pulpit cares.
Yeah.
Thank you,
Really
Annie. We got some warm rooibos tea. Rooibos tea for E. So, yeah, how's the coldness going out there?
No, it's not so bad. At least it's sunny. And then, when the sun is there, at least... the
You should have
temperature
brought the
is not-
sun into the studio with you.
Oh, I wish I could. Yeah.
So, we're
But
talking.
otherwise, it's not bad.
So, we're talking circumcision.
Yes.
The removal of the foreskin,
That's
right?
right, yes.
And some do it for traditional purposes, religious purposes. Some do it for personal hygiene.
That's right.
Some do it for medical reasons.
Yes, that's right.
We were talking about the coldness, the weather, the climate, and all that. Is it the right time to do circumcision, even for medical purposes, right now?
Yeah, look, we in a medical field, we are not affected by temperatures.
Yeah.
Yeah, because we do everything aseptically, in an aseptic and sterile situation. No longer there are no, bacterial invasion or anything.
Oh,
We
right.
do it in a
I hear
theater, in
you.
a setup, it's sterile.
But
So
for
whether
healing,
it's-
when somebody goes home.
No, even with healing, we know that there is that people think when it's hot, you don't heal.
Yeah, well,
faster.
because it might come septic and...
Yeah, no. No. Look, how many operations do we perform? Non-circumcision operations. We do
Throughout the
the year,
year.
and then we don't get all these complications. So, temperature doesn't really,
So if there are any complications because one had a circumcision done
Yes.
medically and
Yes.
then there is complication, what causes that? I remember a mother who had to rush her son to the hospital because when he would urinate,
Yes.
it would come out like 8 streams after
Okay.
that.
All right. Look, before any child has to undergo a circumcision, medically, let's say, the child has to be examined. We have to check the hydration of the child.
Oh, okay.
And then we have to check whether the sugar levels are okay.
Mm-hmm.
We have to check the hemoglobin of the child.
Yeah.
Whether he's got enough iron,
Mm-hmm.
because he's going to need that for healing.
Mm-hmm.
And then you also have to check that his clotting mechanisms are okay.
Yes.
Yeah.
Yes.
You can sometimes, in preparation for that, do some clotting factors test to check if the child can heals well.
Okay.
And then you subject the child to that surgery.
Mm.
And then the complications that we usually pick up is if you miss something pre-operatively, maybe it's got bad clotting factors, then it's a complicator with bleeding. But we can always stop that during the operation, or even after the operation, we can always give medication to stop the bleeding. And then the second thing is infection. But being in a sterile environment, infection is minimized. We don't get so much infection. And in any way, what we do is we give preoperative or intraoperative antibiotics
All right.
in case there's going to be an infection. I know the antimicrobial advocates, shepherds, discourage us to use, not to use antibiotics when it's not really necessary. But in this case, we do give, because it's a boy usually, very young, and then the immunity may not be so very well established. So it's always safe to cover the child with an antibiotic so that you don't get post-operative infections.
What are the medical reasons that one would come for circumcision? And what do we also mean when we say for personal hygiene?
Yeah, we've got some couple of indications actually for medical indications where it's not really compulsory but partially compulsory that we have to do something so that we don't get a negative outcome as the child grows.
Okay.
We've got infections like balanitis, where the head of the penis becomes infected, and then when the skin is covering that infection, the healing is not going to be so well.
What causes that?
We don't know, but it's a bacterial infection.
So it's not the soap that the soap got stuck in the foreskin?
No,
nothing like that?
No, nothing like that.
Okay.
And then the other thing is what we call a paraphimosis. Now, paraphimosis is when the skin has been, it's not able to be withdrawn. You see, that skin should be very flexible.
Yes.
That you can withdraw it and then even take it to the front. But now with paraphimosis, that's when it is stuck in front there.
Okay.
And then you can't even wash the inside of the penis.
Yeah.
And then that's going to cause infections.
Okay.
And it's going to cause some discharges which are not so
good.
Yeah.
I remember a boy who had the foreskin was so small, like at the tip
At the
there.
tip, yes,
You couldn't pull it back, and urine would be stuck in there, so it would balloon as well.
So now that's what we call a tight phimosis.
Whew.
When it can't just retract, you see that. And then you can imagine now with the smegma which is produced inside the skin of the penis, mixed with the urates and other end products of the
can be dangerous.
Can be very dangerous.
Okay.
And then the opposite of paraphimosis, meaning it doesn't come back, is a phimosis, which we've just described now. And then we've got the indications of having to prevent sexually transmitted diseases.
Okay.
It has been established that at least 60% of HIV acquisition can be
avoided
by having been circumcised.
Does it mean that a virus would be stuck in the foreskin?
Yeah, it can be a virus, it can be a bacteria
stuck in there,
and
then passing it on to your partner.
Yeah, you can, but it's small children, in most cases, so they are not sexually active yet. So we don't worry about transmitting it to a partner. We worry about
them contracting it.
Yeah, that's right. And then we've got in an adult, of course, there is penile cancer. You can, to an extent, reduce the rate of acquisition of penile cancer if you're circumcised.
Okay.
So traditionally, I think it's very good that we should all be circumcised. No, but in any way, you have to choose whether you want to circumcise or not.
But there is safety medically.
Medically.
So when we say personal hygiene, what are we also referring to? When we say somebody has a circumcision for personal reasons?
Well, usually...
for personal hygiene reasons.
Yeah, that's right. For personal hygiene.
Reasons.
Look, the skin harbors all sorts of...
bacteria
inside there.
Okay.
And then there are some other people who are reluctant to retract the skin, clean up inside there, and then let it go back again. So if you don't retract it, you're going to have those infections mixed with the smegma which is produced. And it's not a very pleasant thing because you are going to get an infection which can get into the urethra. It will ascend into the bladder.
So you'd have
Yeah.
some UTIs.
UTI, that's right.
Okay.
Or it will in fact go beyond the bladder into the ureters and into the kidney. So,
What?
yes, I mean, any infection which originates from the urethra, or it would have started right down there at the bladder. It would ascend through the urethra, into the bladder, into the ureter, and eventually into the kidneys. But it hasn't really been described so much
Okay.
in literature, but it is possible.
Okay, but now Dr. Tlailane was talking more about children who are getting circumcised. What about older men? Is it fine for an older man to get a circumcision?
Yeah, I'll say for traditional purposes you can. I know there are some other people whose egos is so much great that they don't want to see themselves uncircumcised. Like when we go to the bathroom.
Oh, okay.
Yeah, people look at each other like that. You know what I mean. They say, this one is circumcised, this one is not circumcised, and they start teasing you. Especially
There's a stigma
yeah,
that goes.
there's a stigma which
okay.
goes with it. Especially some other ethnical groups in South Africa. If you're not circumcised, you.
But in terms of HIV, I'm more interested in that.
Yeah.
In an adult.
Yes.
So one could also prevent it.
Yeah, you can prevent it because what HIV does, it gets deposited. Remember, one gets infected from the semen, and then now the semen, if it's
stuck
inside the
foreskin.
yeah,
okay,
the virus is going to proliferate, and it's going to be easy for you to transmit it to your partner.
Okay,
And then, but if it's you have circumcised, it's going to be less transmissible.
Okay.
So it's always best that you should be circumcised, and then you can do it for that. But you don't treat. There are some people who say, "No, I've been circumcised. No, I can't get HIV." No, that's wrong. You still get HIV if you get into contact with somebody
who has. Yeah.
But at least if you are circumcised, 60% chances is taken off.
Okay.
Yeah.
Okay. But it's not 100%.
No, it's not 100%.
So that is a myth.
That's a myth, yeah, that's right.
All right.
And we've got also, trauma, for instance, as the other indications of having to be circumcised. Children usually, as they play, they damage they hurt themselves. And then even with the zip.
Would they even hurt themselves there?
Yeah, they do. And even with a zip, tight fit pens and what have you, try to zip up your pens, and then it'll just grip your foreskin, and then.
What's the underwear?
Nowadays, people don't wear underwear. Yeah, so you grip that skin, and then you end up at
No. We gotta go back to basics, Dr. Tlailane.
Yes, that's right.
We gotta go back to basics.
We once had a child who had to be, localized there so that the zip can be taken off. And
because
then now,
it was stuck.
Yeah, it was stuck on the foreskin. Now, that it had been stuck on the foreskin for quite some time. That skin was gangrenous, so it had to have a circumcision. So that's one of the indications of circumcision post-trauma. Yeah. So there's a couple of them, There is this preputal pulse and redundant foreskin, where on the foreskin you find some whitish things there. They look like cysts.
Okay.
Yeah. Now, those things are very infectious. For instance, if you leave them like that, you're going to end up with an infection at a later stage. So it's best that you remove you remove the skin. Now, that is because of the accumulation of the smegma, which is inside the skin, and then it hasn't got anywhere to go. The skin is not retracted to be cleaned, and then it's always, in front there.
Would there be a smell that comes out as a result
there is.
as well?
There is always a smell. There is always a smell because there is bacterial infection there and fermentation. Yeah. Those are basically
The
the
reasons.
reasons why one has to have a circumcision.
Mm.
But otherwise, considering some of the things, we have to have an informed decision making that it shouldn't be compulsory.
So, from which age, when it comes to a child, when is the right time to do a circumcision on a boy child?
Well, any time is the right time.
Okay.
Yeah,
I remember the 8-day rule.
yeah, you can. Yeah, at 8 days,
Mm.
and then but if there
Does
are
it?
any
Do they heal
challenges,
quicker because of the growth hormone?
no,
Okay.
that one what you call even with a newborn child, if the child is born with some challenges
Like
of
on
tight
the
phimosis,
spot.
yeah, that's right.
Okay.
You can do the circumcision after birth.
Mm-hmm.
As long as the baby is born to a mother who was very fit and everything, had no challenges pre labor or during the pregnancy,
Mm-hmm.
then you can go on to the circumcision.
Okay.
Yeah.
Okay.
And then the only thing is bleeding that we are afraid of, because their clotting mechanisms haven't developed so much. More long, they may not stop
Like
bleeding
when
immediately.
they're newborns or 8 days old.
Yeah.
Okay.
And then only the bleeding and the infection that we're afraid of. And the healing, actually, the younger you are, the faster you heal. But the older you are,
Yeah,
the
that's
more
why I
time
was
you take.
asking. Is it that they would heal faster
Yeah, they
because
heal
of the
faster.
growth hormone or?
And then you see with neonates or young children, we use different methods.
Okay.
We don't use Okay, let's go into these three.
Okay.
We've got 4 modalities
Okay.
of going to do circumcisions.
Yeah.
The number one is the gonko clamp, which is used to clamp the foreskin for some time
Until it dries up.
Until it dries up,
And then it falls on its
and
own.
it falls on its
Isn't
own,
that
or you can
painful?
cut it. Pardon?
Isn't that painful?
No, we localize you.
Oh, okay.
Yeah, and unfortunately, this is not used. I don't know. I haven't been there. It's not used in the initiation schools. I don't know what they really use, but we can use gonko clamps for maybe teenagers and adolescents. And then for the neonates,
So
we
wait,
use,
when you use that,
Yeah.
would the teenager be able to go to school with that?
yeah.
Or they should be at home for some time?
No. There is this other one which is called Morgan clamp. Now, the Morgan clamp is the one which the child has to go home,
Oh, okay.
and then you'll have to wait for it to
Fall
dry
off.
up the skin and
Yeah.
fall off. Yeah,
Okay.
and then that's when the child can't go to school, because
Okay.
you won't be able to be peeing well. Being at school, it's a challenge.
So aftercare would
Yeah.
be needed there.
Yeah. We need
So with
that.
the first one, the gongo clamp?
No, the gongo clamp, we do it that time, and then it clots, and then everything is fine.
Okay.
The only thing is that if there's going to be erections, for instance, with adolescents, when the blood is full in the morning, they get erections, and then they can, to an
Be
extent,
painful.
deglove. What you call.
That
but,
would be
but what we
painful.
are doing nowadays,
Mm-hmm.
we stitch it,
Okay.
or we just apply the glue
Oh, okay.
that holds the skin together.
All right.
Yeah.
So even when the erection happens,
Yeah, and then
nothing
it's still tight,
happens to
yeah.
the child.
Because with an erection, after a gonko clamp, the whole penis can be degloved, But we can always take it back,
Okay. Oh, but that seems to be painful.
No, not really. It's not that painful.
Okay.
Yeah.
All right. I'm a mother. I'm a mother to a boy.
Yeah, I know, I can see that. And then otherwise, we've got the old traditional way where you have to do a dorsal slit. We have to
Cut.
Yeah.
Okay.
Really cut, But fortunately, when we cut, we've got what you call a cauterization machine, which we cauterize all these bleeders that we come across, so that the patient, you don't leave the patient bleeding, and what will happen. Bleeding is the biggest killer, especially with the circumcisions. Bleeding, dehydration, and infection. These 3 things are the ones which cause mortality.
Okay. Sure, Dr. Tlailane. All right, let's take a break.
Yes.
Let's
Thank
come
you.
back and talk to you some more. Family, you can ask your questions.
Right.
Share your comments with us. 012-334-1322. 012-334-1322 is the number that you can dial and talk to us. Maybe you have experienced some complications. You get questions around or surrounding circumcision. You'd like Dr. Tlailane to answer those. The lines are open for you. Our WhatsApp number 082-657-2729. Our SMS line 37871, which will cost you just R1.50. And we are live on Facebook. Hello, Willie Brutz, all the way from Johannesburg, tuned in and also encouraging us to pray for Israel. Thank you so much, Vili, and thank you for choosing us as your number one radio station. We're taking the sounds of Zizi featuring TK Zamar, and the song is Holy Spirit. Ons kom terug.
Come and ask your questions. Share your concerns. Experiencing life on 657 AM.
Hi there, folks. Michael Heath here from Heath and Wenzel Optometrists. We've had the privilege of serving your family's vision needs since 1957 and will continue to offer the best vision solutions, from the latest in diagnostic and lens technology to vision therapy and everything in between. Call Linwood on 012 348 1177 or Linton's Corner on 012 880 8828 to book an appointment. We'll see you there.
CBC Centon will be hosting its winter convention from 20th to 22 June at 76 Bevan Road, Rivonia. The
whatever you require, whatever the case may be, open your eyes to see endless possibility. He shall perform it. Lift your hands up to the sky and receive. Open your eyes to see endless possibilities. Oh, release your faith and believe. Lift your hands up to the sky and receive. Open your eyes to see endless possibilities.
Feel the pulse of the real life on 657 AM. 657 AM. The sounds of your life.
Such a blessed melody in the morning with Thengiwe Mdlalose, I believe. Before that, Tsitsi featuring TK Zamar with Holy Spirit. You're listening to Just For You with you up until 11 o'clock. I'm Spongile Mofokeng Dedezais Besuk with Dr. Tlailane. You get a medical question that you'd like to ask. You can call in and ask any question. You don't have to dwell on what we are talking about. Yeah, we are talking about circumcision, but you can ask any question that you have medically whilst the doctor is in the house. That is Ways Besuk. And then you can use these numbers 012-334-1322, 012-334-1322, our SMS line 37871. Do remember that your SMS will cost you 150. And our WhatsApp number 082-657-2729, 082-657-2729. It's also our Telegram line. We are on Facebook. You can write your comment on Facebook or your question on Facebook. We will also get that. Mara, I see you are tuned in, also making us realize that you are standing together with Mr. Birds, praying for Israel. And yeah, we believe in what the word of says that says, pray for the peace of Jerusalem at Radio Pulpit. We do stand in the gap and pray for Israel. Alrighty then, it is Circumcision with Dr. Tlailane on Just For You. And at 11 o'clock, we will be saying goodbye to you and shifting for the news. And after the news, Germany Yanni Belsa met Perspective. He will be with you on Perspective. So Dr. Tlailane, how long does it take for one to heal? When we are talking circumcision, how long?
Yeah, well, it depends on the age of the person. Yeah, usually it's younger children, from 8 days up to about 3-6 months. They take about a week to heal. And then the rest will take something like 1.5 weeks. Let's say 10 days to 1.5 weeks. And then adults usually takes about 2 weeks. Because somehow the healing process with adults, it's compromised to an extent. I don't know, because maybe the skin has been there for quite some time and has been eroded, and all sorts of things has been done to it. See.
And what about the aftercare?
The aftercare,
is it a scary process? I think most mothers are like, whoo.
No.
Especially if you're a mom and you're taking care of a boy alone.
Yeah. Aftercare, it's not so difficult really, because look, with the medical one, what we do, we stitch what you call the skin, or we apply the dermabond, which holds the skin together. Yes. And then with the stitches, you don't have to do anything. You just wash with salt water. You don't even have to go and buy one of these antiseptics. Yeah.
Okay.
Besides, those things are very corrosive, and they eat the stitches. So the stitches can be eaten away before the wound completely heals.
Okay.
So salt water is always the best.
Salt water will. So do you use that? I don't know, the stitch that will come out on its own.
Yeah, that's right.
Okay. I don't know what you.
Up.
Oh, okay.
Yeah.
Sometimes you can see it in the water.
Yeah.
Okay.
You can see it is, and then you can apply some cream, an antiseptic cream, just to prevent bacterial invasion.
Okay. But is there a need for that?
Usually there isn't,
water?
but I think there's nothing wrong with having to apply an antiseptic cream there. It's for the good.
Oh, okay.
So that's right, yeah. So it's not that very difficult to really take care of a circumcision post.
Can they walk?
You walk,
run,
all sorts of things, yeah. There was a little boy who was circumcised. The following day he was at soccer
Ha!
Yeah, he was playing. Because the anesthetics and the antibiotics...
But what if the bow, or was he wearing a shield?
No, it's not painful at all.
Okay.
Yeah, okay, it's painful, but they can enjoy
Bearable.
the pain, yeah. They can bear that.
Okay.
Yeah. Look, you know what? If before we run out of time, I
Yes.
just wanted to look at the considerations, especially when it comes to circumcisions. Informed decision making. The number one thing it's essential to weigh the potential benefits and risk of circumcisions and make an informed decision based on individual circumstances and values. So don't just
Wake up and say, I'm doing
going
this.
to the
Yeah.
to circumcision. There are boys now who take themselves to the initiation school, and then there are those who are abducted and something like that. So all those things we should be considerate of. Now, medical necessity, circumcisions is sometimes performed for medical reasons such as phimosis and recurrent balanitis, like I've just alluded earlier on. And we know that at least it reduces the rate of HIV.
HIV?
Yeah.
Is it just HIV or any other sexually transmitted?
Other sexually transmitted
Okay.
diseases, yes. But in this case, we are targeting HIV because these other ones, it's easy to treat.
Oh, okay.
Yeah. And then for cultural and personal factors, circumcision is often a cultural or personal choice, and individuals should consider their own values and preferences when making a decision. Right. Like even a medical doctor, will not circumcise you if he hasn't got informed consent that you should continue the procedure.
Okay.
You will be counseled fully about the pros and cons of having to be circumcised. You'll be told the advantages, like the hygiene, reduced risk of STIs, lower risk of penile cancer, and then you'll also be told about how easy it is to take care of the circumcision after surgery.
Oh,
and then
you,
you'll also
you
be
did
told,
mention that it lowers the rate of what? Penile cancer.
yeah, that's right. It does.
And where would the penile cancer be? On the forehead, on the skin, on the...
Usually it's on the skin itself, or sometimes it's on the bala. Yeah, that ball. And then you'll also be concerned about the disadvantages, like pain and discomfort. It should be explained to you that there's a lot of pain sometimes, and a discomfort and swelling, especially if not performed with proper anesthetics. But we always make sure that we give good anesthetics. Like what we do now with children, we give general anesthetics, and then after that we also do a penile block, so that there is complete anesthesia on the area we are going to operate on. And the risk of complications like surgical procedure, and then you'll be told whether, with all the risk of complications such as bleeding, infection, and scarring. There are some other people who scars badly. There was some time I think we spoke about the keloid. Remember when we spoke about the keloid?
I remember the word, but
yeah. Right. Keloid is overzealous healing of the skin, where you are going to have this abnormal, protuberance of the skin, scar. Sometimes it does okay, and then it doesn't give a very good cosmetic look when you have healed on that side.
Okay.
And then loss of foreskin function, you'll be told about that the foreskin has nerve endings and may play a role in sexual function and sensitivity. So they will, to an extent, have a sexual effect there. So you will be concerned about that.
Okay.
And cultural and personal concerns, circumcision is a personal and cultural issue, and some individuals or families may object to the procedure for various reasons. And then if there is any objection, we may not proceed with the circumcision. So those are basically the things that we have to really be...
Repeat the last part, if there are any.
If there are any concerns from the family or Yeah, that's
Are
right.
there reasons besides the family? Are there medical reasons that are there that would cause one not to have or
I'm not
not
aware
to
of.
be
I'm not aware of them.
circumcised?
I'm not aware of anyone. But
Especially with the
traditionally,
evolving science, I believe things are totally different from back then.
from back
Because
then,
when we were on air, we were talking about a patient with Duchenne muscular dystrophy
yeah,
whom doctors felt reluctant to even take on.
yeah, that's right.
Yeah, because they were afraid of the anesthetic, what it might do to the muscles.
Yeah,
So
yeah.
things have changed.
Things have changed altogether. Like the patient with a Duchenne, what we could do maybe is to avoid general anesthetics and do only local, and then maybe be under conscious sedation, with a local anesthetic. That could work. But if the family is not for that, then we don't proceed. We just don't go on.
Okay, then.
Yeah.
All right. Okay, but is it healthy to stay with the foreskin?
Well, if you are good at taking care of your hygiene, your personal hygiene, then there's no problem. I've got many patients who are not circumcised and they haven't got any challenges
They're
with that.
fine.
Yeah, they're fine.
So when should you start be getting worried if you have a foreskin?
If when you retract it, it refuses, or when you have retracted
can
it,
it
it doesn't
stop?
want to go back. Pardon?
Can it stop? Maybe it was you could retract it before.
Yeah,
Can it stop?
it can stop because sometimes you get an inflammation of the head of the penis, which will involve the inside of the foreskin, and then it will cause an inflammation, and there will be some adhesive processes going on there, and then to clean and get attached to the head. And then you may not retract it. As you retract it, you'll be feeling pain, and then you just let go and say, no, I'm not going to do this.
All right.
And then you just let it grow like that, and then eventually you're going to have that tight phimosis where you don't retract at all. And then you have to be circumcised under general anesthetics or local anesthetic, depending on the age.
Okay.
Yeah.
Let's take the last break and then we're coming back with Dr. Tlailane and we're talking circumcision. You got questions? We're still open. Antonio Neil in the background, the only one.
Words could say you you examine. I adore you. Lord, I adore you. And I bless you. Lord, I adore you. Lord, I adore you. Beautiful, that's what I call you. Wonderful, that's what I call you. That's what I call you.
Die Hilton Road Garage met 'n Shell Select winkel en OTM is verseker die 24-uur vulstasie om by te stop wanneer jy op reis is in KwaZulu-Natal. Hilton Road Garage is geleë in Hilton op pad na Durban, net 10 minute buite Pietermaritzburg. Gaan wel met Shell. Skakel hul gerus by 033 343 3275. Die Hilton Road Garage. Maak jou reis net beter.
Dis tyd vir sielerus en ontspan. ATKV Buffelspoort bied jou die perfekte wegbreek met ons alles-in-een promosie. Kry 'n kampplek vir 2 persone teen net R220 per nag vir lede en R250 per nag vir nie-lede vir 'n minimum van 5 nagte. Die Bosveld Loerie roep. Bespreek nou. Bepalings en voorwaardes geld.
Ulwazi oluthe vetshe, impilo engcono nothando oluthe gabalala. Radio Pulpit 657 AM. Umhlobo wakho wemihla ngemihla.
That's where you at, and we gave you the sounds of Antonio Neil, the only one. We are about to wrap up. We are wrapping up, actually. It's time to wrap up. But a quick one. A family member is asking, Peguya Asmakifi, what would you say heals asthma, or how can one be healed from asthma?
Well, it's difficult to be healed from asthma. You know, you're stuck with it for the rest of your life. And then, but there are some other people who, you know, it goes away by itself. But the bronchodilators are the medication that I used, and the inhaled corticosteroids, that is the steroids that we inhale by an aerosol.
Okay.
Those are the best that we are using nowadays.
Okay.
Yeah.
And so the person can talk to a doctor like yourself
that's right,
to find out.
Yeah.
Okay. Dr. Tlailane, what do we say as we wrap up? We don't have time anymore.
No, that's all right. I don't think, like, I was going to ask the feminists that who are very strong about having to have, according to the culture, they need their children to be circumcised. Make an appointment with your doctor, and then who will make a necessary arrangement to get the child circumcised. It's a very easy procedure. It's an in and out one day, and then everything is fine.
Mm-hmm.
Yeah.
And Dr. Tlailane, where can we get hold of you?
078 738 2694.
078
738 2694.
Dr. Tlailane, thank you so much for always coming through and educating and empowering us on these. Sometimes we don't know where to go or who to ask, but thank you for his besuk with you all the time.
You're welcome, and bye-bye to the family out there.
May God awesomely bless you.
Bye-bye.
Family, we are signing off, and we say hello to Germany, Yanni Belsa on Perspective. We're going to take the news first, the news bulletin at 11 o'clock. And after the news, you are with